Hello everyone, welcome to sqadia.com. I am Dr. Shafaq Jaleel and today we are going to talk about traumatic brain injuries. Traumatic brain injuries is a wide terminology, and in this lecture we are only going to discuss concussion and the related injuries. So what is concussion? Basically, concussion is a mild type of traumatic brain injury, and it can occur after an impact to your head or a whiplash type of injury that results in the movement of head and brain back and forth. It might lead to altered mental status or unconsciousness. Around 10 million cases of head injury occur annually in US. Out of these, 20% are the cause of brain damage. Motor vehicle accidents are the main cause of death in young adults or less than 35 years age, and more than 70% are the cause of head injury in these cases. Whenever a doctor is dealing a patient of head injury, they should keep three things in mind. Number one, head injuries are usually accompanied with spinal injury. So these patients should be handled with care in order to prevent the compression of spine due to the instability of spinal column. Intoxication is associated with this traumatic brain injury. So test for drugs and alcohol intoxication. And if you are suspecting a ruptured abdominal organ, you should provide immediate attention to these patients because they might undergo endovascular collapse, shock, or respiratory distress. So in this lecture, we are going to talk about concussion. We will see what are contusions and axonal shearing lesions that can occur after a concussion. What are different subdural or epidural hematomas, and what are the effects of and the clinical features of skull fractures, and how we can manage all these. So we have divided this presentation into 5 sections. The first section is mainly about the introduction of concussion, the mechanism of concussion injury, the changes that take place in brain after concussion, and how it affects your memory or how it can cause amnesia, and what is the mechanism of blast injury that is affecting brain. In the second section, we will talk about contusion and axonal shearing lesions, the signs and symptoms of contusions and how we can diagnose it, a hemorrhage that occurs after a concussion, how we can diagnose it, and what are axonal shearing lesions. In the third section, we will talk about head injury, different types of skull fractures, and the different clinical scenarios or clinical features that appear after a head injury, and what are the signs and symptoms of cranial nerve injuries, and how a head injury can lead to the initiation of seizures. In the fourth section, we will talk about subdural and epidural hematomas, how we can differentiate an acute subdural hematoma from a chronic subdural hematoma, and what is an epidural hematoma. And in the final section, we will talk about the treatment of head injury. First of all, we will see the difference between minor injury, the injury of intermediate severity, and severe injury, how we can grade the severe injury, and what is the prognosis according to the grading. And we will end our lecture on post-concussion syndrome. So this is all about today's lecture. I hope you are excited to learn about this topic. Do watch other sections of this lecture. Keep watching sqadia.com.